Hi folks, Ron Ray here with Turning 65 Solutions. I just kind of stuck in a traffic jam here today, so I thought I'd take a few minutes just to kind of go over some of the different parts of Medicare with you. So if you are going to be turning 65 sometime in the next 6 months or so, you're getting a lot of information right now. You're getting a lot of mail, you're getting a lot of phone calls, and you may even have people show up at your doorstep. Some stranger will show up on a Sunday afternoon while you're working in your flower bed and want to wish you a happy birthday. Well, the reason that's happening is because they all know that you are turning 65 and you've got some decisions that you have to make with regard to Medicare. And you may have a lot of questions. You may have already done your homework and you know what you're going to do, and that's fine. If you've got some questions, I'm going to try to answer just a few of them here in just a short period of time. Hopefully before traffic starts moving quickly again and I have to get off of this just for safety. But for right now, it's pretty safe. We're not moving very fast at all. So when you turn 65 and you're going to go on Medicare, you've got two choices. Medicare, that is original Medicare, where you keep original Medicare A and B, or Medicare Advantage. That's also called Medicare Part C. And what that is that's the contracted side of Medicare. So with original Medicare, that's choice number one, you keep original Medicare A and B. Medicare Part A is your hospital insurance. Medicare Part B is your medical insurance. It covers doctors and office visits and outpatient. You pay $135 a month, $135.50 as we sit here in 2019. And Medicare Part A you've already paid for with your payroll taxes all your working life. And they cover a lot of your bills, but they leave a lot behind for you to pay. So that's where you are going to get yourself a Medigap plan, also called a Medicare supplement. These are the plans that you've heard of. Plan F, Plan G, N, there's a Plan K, there's a Plan C that some people still like. There's a whole bunch of them. They're all just a little bit different, and they're all have their pros and cons, and they're good for certain situations. And their job is to pay all or some of your share of that Medicare bill. So for all your office visits, your doctor bills and hospital bills, Medicare is going to pay their share and you're responsible for your share. In the case of doctors, that's 20% is your share. So you would get a Medicare supplement plan, a Medigap plan that would pay all or some of your share of the bill. Now, original Medicare nor Medicare supplements cover prescription drugs, so you would also want to get a separate prescription drug plan that's covered under Medicare Part D. It's real easy to remember, D for drug. Those are separate plans. Now, under original Medicare, you can go to any doctor or any hospital that you choose as long as they accept original Medicare. That's the only requirement. In fact, the doctors don't even bill your insurance company, your Medigap. They bill Medicare, and then Medicare bills your insurance company. It's called an electronic crossover, and the crossover happens at the Medicare level. So you can go to any doctor, any hospital that you choose. Also, there's not going to be much out of pocket because depending on the Medigap plan that you choose, they're going to pay most of the bill. So no more co-pays, no more co-insurance. You just pay, say in the case of a Plan G, you would pay the $185 deductible for Medicare B, and then that would be it for the rest of the year. And also, there's no managed care, so you don't have an insurance company calling the shots as to what treatments you do or do not get. Medicare is pretty much, for the most part, for everything that's medically necessary, approved everything ahead of time. As long as the doctor's office is sending the right code to Medicare, it's going to be covered. And then once Medicare approves it, your Medicare supplement plan is obligated by law to pay your share of the bill. The insurance company has no say in the matter. If Medicare approves it, the Medigap plan has to pay. That's original Medicare. Your other choice is Medicare Advantage. This is also called Medicare Part C. And what happens here is, though you continue to pay the $135.50 a month for Medicare, even though that may be directly deducted from your Social Security check, you keep paying that. That doesn't go away. But what happens now is Medicare sends that money over to this private insurance company that you choose, and they now provide your Medicare services for you, taking Medicare out of the picture. Now, I want to be clear here. You do not lose Medicare. You're still in the system. But what has happened is for that calendar year, you have been contracted out to this insurance company. Medicare says, here's the money, you take care of them, we're out. And now, well, you play by their rules. These are the HMOs and the PPOs. So now you have to go to their doctors. There's a list of doctors. We have doctor networks. You have to go to their doctors. In the case of an HMO, that is very strict. You really only can go to their doctors. Now, PPOs are more open. They'll let you go to doctors that aren't on the list. You just have to pay the out-of-network cost, which can be 2 or 3 times the in-network cost. And now, not only do you have a list of doctors, because you have a doctor network, you also may be restricted to a service area where you have to live and obtain your services. And if you move or travel out of the service area, your insurance may not work anymore. And now the other thing that we have is something called managed care. Remember, Medicare's out. They said, here's the money, you take care of them. Now the insurance company gets to call the shots on what they pay for. And so for anything that's not a life and death emergency or just a regular office visit, you may have to get permission from the insurance company first. And the insurance company can say no. Now, they're not going to say that you can't have that treatment. They're just going to say that we're not going to pay for it, which for most of us, of course, means you can't have it because you can't afford it. That's why you have insurance. Or they could put you on something called step therapy, which says, we're not going to pay for that treatment yet. We want you to try this other cheaper treatment first, and if that doesn't work, then we'll pay for it. Of course, that prolongs your treatment, prolongs your illness. You may die before you get back over there out of the treatment. So it's the insurance company calling the shots with your health care, not you and your doctors. But the pros to these plans are that in addition to the $135 that you're going to continue to pay for your Medicare Part B, you may pay little or no additional premium for your plan. Most of the HMOs still have a 0 monthly premium. Almost all the PPOs cost money. Some of the PPOs can be pretty pricey. They can cost as much or more than a Medicare supplement, so you kind of have to watch out. One of the other good things about them is most of them, not all, most of them do still provide the drug coverage in one plan. So you have your hospital, your medical, and your prescription coverage all in one plan, so it's pretty convenient. And then the other good thing is they do limit your out-of-pocket. So with original Medicare, there's no limit to the amount of money that you can pay out of your pocket. 20% of your entire bill you pay. There's no limit. These plans do limit your out-of-pocket to somewhere between $4,000 and $7,000 a year, depending on the plan that you pick. Some of them do still provide some very basic dental and vision services, and some of them do still provide some extra services, some extra help, with things that aren't really part of a medical plan, usually like over-the-counter supplements and drugs like aspirins and things like that. They may provide some credit for that. They may provide a free health club membership or some other things, some ride, some transportation benefits, something like that. It's not medical, it's just an extra add-on. So those are some of the good things about them. Some of the bad things about them we already discussed. We don't really know exactly what's right for you, original Medicare, Medicare Advantage, until we look at your case. So now the way we work is we represent all the major insurance companies that do business in Texas. We're independent brokers. They all pay us, and they all pay us about the same. They're very competitive that way. So what that means is I don't care which plan you go with as long as it's right for you. I work for you, not the insurance companies. So if you want to meet with me and find out, what plan is best for you, if you still have questions, if you still have questions about which way you need to go, or if you're still working and you have insurance from your employer, or you're retired and you have insurance from your company, you have a few more questions that you need to answered, we can help you with all that. Just give us a call at the number on your screen. We're always happy to help. We're local agents. We're right here in your community, and always here to help. So traffic's moving a little bit quicker. I'm going to get off of this phone right now so I can drive safe. I hope I've been helpful. If so, give us a call, and we'll see you. Thanks, folks.